and welcome to our live webinar for, let me see, Tuesday, June 2nd. So my name is Rob. I'm going to be your host for today. Some of you might remember me from last Thursday, where we had our first session. We're doing something that we call Walk and Talk with Rob. We have had a lot of feedback from patients that they're looking to see if we can provide some live exercise sessions that they can follow along at home. So this is our attempt to do that, and week number 2. So once again, my name's Rob. I'm one of the cardiac rehab supervisors here. I'm also clinical coordinator. I've been here for about 26 years. I always joke and tell people they hired me when I was 4 years old, and I'm going to take you through our session for today. So just a couple of things to get out of the way. These exercises will be familiar to people who have been participating in our program. We're going to do our dynamic warm-up. We'll do about 15 minutes worth of cardio. We'll probably do a couple of resistance training exercises and then some stretching. It shouldn't be a surprise to anybody who's familiar with what we do. But if you've never done any exercise and you are a cardiac patient, it's probably a good idea to make sure that you get an okay to exercise safely from your doctor. So please make sure you do that. These sessions are recorded, so you can go and take a look at them at a later date. We do these sessions twice a week on Tuesdays and Thursday afternoons at 1 o'clock. But everybody knows you should be looking to exercise 5 days per week. So you can always go back and repeat them if you find that helps in any way. If it's motivational, that would be great. And the exercise that we're doing, it's more lower intensity activity, which should be comfortable for everybody. If you have any pain or symptoms, please make sure that you stop doing the exercise. The symptoms don't go away right away. Do make sure you access your emergency services, okay? So just our kind of our warnings. Following on that trend as well, do make sure if you're going to join us for the exercise that you are feeling well, no symptoms. Hopefully you've had some fluids, something to eat. Make sure that you've taken all of your medication, and if you're living with diabetes, hopefully you've checked your blood sugar and it's at a good level before we exercise. So there we go. So those are the preambles. I'm going to stop my screen share. And there we go. Now you can see me. Okay. So let's get started. So as everybody knows, these exercises, I'm trying to do them at a speed and a pace where everybody can follow along. So hopefully nobody is sitting at home just sitting there watching this. Everybody should get up and follow along. So when we do our exercise, we start off with our dynamic warm-up, the first exercise of which is marching. So let's just do our marching for about 30 seconds or so. As everybody knows, we're going to be doing some walking in the spot, so we need to warm up those leg muscles, get the blood flowing so our heart gets ready for the exercise. This is important to do. So just marching in place, nice and light and easy is what we're going to do, just for about 30 seconds. Okay, so that's our 30 seconds of marching. Next thing we're going to do is we're going to try and loosen up our hips. So grab onto something that's nice and solid. I'm going to use my friend, the fridge here. And then what we're going to do, just some nice light movement with our legs. Not super aggressive, just warming the joint up so it's ready to do a little bit of activity. Will make you feel a little bit better when you do it. Okay, and then we'll switch legs, turn around, grab onto something again for some support. Just some nice deliberate movements with the hip. Back and forth, making sure you stand up nice and straight and tall. Upper body really shouldn't be moving all that much. Okay, good. Then we're going to loosen off our ankles. So if you want to lean against something for a little bit of balance, that's fine. And then we're going to just do big, deliberate circles with our toes. Round and round we go. Making sure that we get both directions. So feel free to switch. And then making sure that you get both feet. See how much cracking and crunching your joints can make. Make sure you get both directions. Okay, and then we'll just finish off with shoulder circles in the low back, big circles, slow and deliberate. We're not doing anything really aggressive here. And once again, making sure that you get both directions. All right, so we're all nice and warmed up and loosened up. One of the things that we should be looking to also do, if possible, is let's see if you can get a resting heart rate for 10 seconds. So you can get it at your wrist or up here in your carotid artery in your neck, whichever feels comfortable for you. Find your pulse, and I'll give you a 10-second pulse count in 3, 2, 1, go. And stop. So we've got a resting heart rate. Hopefully it's a number that's in your usual, in your regular range. Typically we see numbers anywhere from 8, 9, 10 at the low end, up to 15 or 16 at the high end. It's going to vary person to person, and that's fine. Okay, so we've done our dynamic warm-up. Now we'll start doing our aerobic warm-up. For our aerobic warm-up, we usually encourage people to do whatever activity you're going to be doing for your exercise. For us, it's marching on the spot. Do that, but just at a slightly slower pace. You guys remember from last week, what this does is it gives our body's blood flow a chance to optimize, to get ready for the exercise that we're going to be doing. For marching, we'll dilate the big arteries, bringing oxygen-rich blood to the legs. That's good. We'll probably constrict the blood vessels to our gut. We need to get that extra oxygen-rich blood from somewhere, so typically this is where we'll take it from. And then we'll also dilate the coronary arteries too. Get them an awful lot big so we can bring all that good oxygen-rich blood to our heart. Make life for our heart nice and easy. And we're going to do this warm-up for about 4 minutes or so, 5 minutes. Not only is it good for our hearts, but it also makes the exercise feel a little bit better. You're less likely to get short of breath if you do a good warm-up. If you're prone to getting angina, you'll have less angina. Hopefully you'll have no angina when you do your exercise. Warm-up is important. It's one of these things that we always tell people you should never really try and skip. Now, if you're feeling this is easy, if you tend to exercise a little bit more vigorous, one of the things you can do is you can add more muscle mass to your exercise. So something as simple as moving your arms while you do your exercise. One of the things this does is the more muscle you use when you exercise, the more oxygen-rich blood your body is going to need. Remember, it's your heart that delivers all of this oxygen-rich blood. So if you need more of it, your heart's going to have to work a little bit harder. It's going to have to beat a little bit quicker. And this is a good thing. We like it when our heart beats. And if we get our heart beating a little bit quicker, that's good too, because that's going to help keep us fit, help get our heart in better shape. And a healthy heart is what we're all after. It's going to keep you around for a long time, keep you out of the hospital, decrease your risk of having any other cardiac events, and all that good stuff. So still doing our warm-up. I think we've got about another minute or so. I have to admit, doing these in front of the camera, it's kind of new for me. I get distracted easily. And especially without my support person. Crystal normally helps me with these. She's helping me from afar right now. So hopefully I don't mess up, Crystal. Hopefully. So one of the things that I'm trying to do is just watching me walk like this is probably going to be pretty boring. So I'm trying to find interesting things that I can talk with you guys about just to kind of pass the time. When you're listening to these kind of things, I find, or if you're talking to people, just makes the exercise go a little bit quicker. And let's face it, that's a good thing. So last week we spent a fair bit of time talking about angina. What is angina? What causes it? How should we manage it? Those kind of things. After the session last week, I said, if anybody's got any questions, send them in. I need stuff to talk about. And I like talking about things that you guys might be interested in hearing. So we had 2 questions come in last week. One was about what kind of exercise can you do when you're sitting down? So we'll talk about that. And then the second one was about something called atrial fibrillation. So I'm going to try and talk about atrial fibrillation a little bit. I won't lie to you, normally when I talk about atrial fibrillation, I use a nice whiteboard and I can draw pretty pictures and all that stuff. I can't do that because I'm here in my kitchen, but I'll try and I'll see what we can do. Okay, so that's our 5-minute warm-up. So if you'd like to walk a little bit quicker, march a little bit faster, that's great. Remember, you should feel comfortable, no pain, no symptoms, no palpitations, dizziness. You should feel good. It's not a bad thing if your breathing goes up a little bit. I mean, I'm doing work. My leg muscles need more oxygen-rich blood, which means that, yeah, my heart's got to beat a little bit quicker, but I also need to breathe a little bit more to get that oxygen to my heart. So this is normal physiology. This is a good, healthy thing. Nothing to worry about. We do get some people that are new to exercise that say, oh, I'm short of breath, I'm short of breath. No, it's not being short of breath. You're just breathing a little bit faster, and that's normal. It's a natural part of exercise and any kind of activity, really. Okay, so let me see if I can answer the 2 questions that came in last week. Let me see, the first one, if I remember correctly, the question is, what kind of exercise can we do while you're sitting down? Heart's a wonderful organ, but remember, it's not smart. All your heart knows is, hey, muscles are moving. I need to send oxygen-rich blood. So your heart doesn't know if you're walking, if you're biking, if you're swimming, if you're on a treadmill. It doesn't know any of those things. So as long as you're doing an activity that gets muscles moving, your heart rate's going to get up. So some of the people in our program might know that very first dynamic warm-up exercise we do, the marching on the spot. You can also do that sitting. So if you're sitting on a chair, you can just march on the spot with your legs. Using the big muscles, that's going to increase your heart rate, and that can give you a bit of a training effect. So seated marching is something you can do as well. You can also start using the upper body as well. You've got bad hip and knee, and maybe you can't do as much walking as you'd like. If you're sitting and marching, and then you add some kind of arm movements, that's going to use more muscle mass, that's going to use more oxygen-rich blood, and that's going to give you a training effect. So anything that uses muscle is going to be good. Typically, when I think about exercise, the type of exercise doesn't really have much to do with the heart. The type of exercise is more a focus around the joints. As far as your heart's concerned, whether you're walking or whether you're biking, it's the same thing. We can train your heart really, really effectively with both types of exercise. It's the same. But when it comes to your knees, well, it might be a little bit different. Walking might be so good for your knees, but maybe biking is. So then I would encourage people, if they've got bad knees, to maybe do some biking instead of the walking. The same for your heart, but it might be better for your knees. So it's the same kind of thing with sitting. Just find ways to move, even while you're sitting, that use muscle mass, and that'll give you the training effect. The more muscles you can use, the greater the work on the heart, the better the training effect. So hopefully that answers your question about what can I do activity-wise while I'm sitting. I just want to throw in kind of a bonus answer to that as well. One of the things that we're talking an awful lot about of late, and seems to be a problem with COVID, is a sedentary behavior. You know, I'm phoning patients and they say, Rob, yeah, I'm sitting on the couch for 4 hours straight. And that's not healthy. There's different kinds of fitness. There's something called cardiovascular fitness, cardiorespiratory fitness, heart, lungs. That's what we're working on right now. There's also something called metabolic fitness, which is your cholesterol, blood sugar, blood pressure, that kind of stuff. If you end up sitting for an extended period of time, your physiology just slows down. It gets kind of sluggish. And that's associated with a whole bunch of negative health outcomes. I always think it's like having a snow globe. You've all seen those pretty glass spheres, the snow globes, pretty scenes inside. You give them a shake, and all the little snow flies around and it looks beautiful. Then you take the snow globe and you put it down on the counter or bookshelf or something, leave it there for an hour, and all that snow kind of settles and it turns into a bit of a white sludge at the bottom of the globe. It's not so pretty. Well, people are like snow globes. Right now, with all of us at home and me here moving around, that's like we're shaking our snow globe. Keeps the metabolism and the physiology moving. If you sit down for an extended period of time, your metabolism and your physiology really, really slows down, becomes sluggish, and that's associated with all of those negative health outcomes. So even though we just talked about in our first question, what can I do to exercise sitting down, I would still encourage people to try and get up at least every half an hour. You don't have to do an awful lot. Just get up, walk around the couch, sit back down. That keeps your metabolism and your physiology moving a little bit and is associated with better health outcomes. So something to keep in mind. All right. Weather's getting warmer out there. It's important that we hydrate, especially if you're screaming at the top of your lungs in a very small kitchen like I am. Feel free to have something to drink, some water. All right. What was our second question? Atrial fibrillation. So let's see, what can I tell you about atrial fibrillation in the next 9 minutes? Our heart has got a number of different systems in it, all right? It's got a pumping system, it's got plumbing. It's also got an electrical system. Your heart beats on average 100,000 times a day. And every one of those heartbeats starts with a little spark of electricity. The upper right part of the heart, we got a specialized clump of cells called the sinoatricular nodes. It's your heart's natural pacemaker. And this little clump of cells will generate an electrical impulse. That pulse of electricity will pass over the top part of the heart, getting the top part of the heart to contract. And it'll pass through the bottom part of the heart, getting the bottom part of the heart to contract. And of course, as the heart contracts because of this electrical impulse, bloods get pushed out either to the bottom part of the heart or out to the lungs and the body. So every heartbeat starts with one little pulse of electricity. That's important to know. Second thing that's important to know is that little pulse of electricity, when it passes over the top and then the bottom part of the heart, usually passes along the same pathway. For example, when you look at an electrocardiogram, an ECG, if you've been in the hospital, you see that little machine bipping away and the line that goes across. When you look at that, you guys will recognize that a lot of the time the pattern, it repeats itself. It looks the same beat after beat after beat. An electrocardiogram is a picture of the electrical pathway in your hearts. And if the electricity always goes down the same pathway, you're going to get the same picture. That's why the ECG always looks pretty much the same beat to beat. Now, one of the cool things about our heart, and there's a lot, is that your heart's got some backup systems in it as well. So imagine, if you will, if your main electrical system breaks down. Without electricity, your heart's not beating, and that's going to be a problem. So if the main system breaks, it's really important that we've got backup systems. And we do. Scattered throughout the entire heart, the top and the bottom, are these backup electrical generating cells. And they're programmed pretty simply. These backup systems are told, listen, we need electricity. Without electricity, the heart's not beating, and that's a problem. So for you backup guys, just watch for electricity. And if the main system breaks for whatever reason, one of the backup guys has to take over. And it'll be able to generate electricity to replace what the main system is supposed to be doing. It's a very basic description of the main and the backup electrical system of the hearts. Now, we know that in the body, stuff wears out. Well, there's your hips, your knees, your back. All the stuff in our body wears out as we get older, including the electrical system, the main one and the backup one. So as the electrical system wears out, it might not fire perfectly every single heartbeat. Sometimes it'll misfire. You get a small little arc, short circuit, or problem. It's common. Happens to everybody out there, happens to me. Everybody in the world gets the occasional misfiring of their electrical system. But as we get older, you guys know stuff wears out, right? So as we get older, the misfirings of the electrical system, they happen a little bit more common. And they can happen in different patterns and pathways. And each one of those patterns or pathways is going to be labeled or described a different way. So we had a question asking about atrial fibrillation. So atrial fibrillation is a problem with the electrical system of the heart. What happens in atrial fibrillation is, instead of one electrical impulse passing over the top part of the heart, you have multiple electrical symbols passing over the top part of your heart. 2, 3, 10, 20, 30. You can sometimes have what they call an electrical storm of impulses passing over the top part of your heart. Okay, I'm going to interrupt that right 1 second. I want everybody to get a 10-second pulse check, because that's the end of our 15 minutes. When you're doing that pulse check, I want you to kind of lean left and right. I'll explain why in a second. Find your pulse and start your 10-second pulse check in 3, 2, 1. And stop. Okay. So we're leaning left and right when we do our pulse check, just to keep the big muscles of the leg moving and keep the blood getting pushed up. If I stand perfectly still, I might get a little lightheaded and dizzy, and that's not a good thing. So always keep swaying. Now let's do our 3 to 4 minutes of cool down, just nice and light and easy. So I was talking about the electrical system and then electrical storm in atrial fibrillation. Normally, one electrical impulse passes over the top part of the heart, and that results in one heartbeat. If you have many electrical impulses passing over the top part of the top part of the heart doesn't just contract nice and smoothly and efficiently, it just kind of twitches a little bit. When that happens, that's called atrial, because the electrical problems are in the top part of the heart, which are called the atria. And they just kind of fibrillate, which is just kind of twitching away. So the consequence of atrial fibrillation is the top part of the heart is not pumping nice and smoothly as it's supposed to. It's just twitching. So that results in I guess, a couple of things to be aware of if you get it. The first one that we worry about is it can make you a little short of breath. The top part of the heart is helping to push blood part of it is oxygen-rich blood to the working muscles so you can do activity. Well, if the top part of your heart isn't pumping so effectively because it's fibrillating, it's twitching away, you're not moving as much oxygen-rich blood, which makes it harder to do stuff. I know a rough rule of thumb that I tend to use with people with atrial fibrillation is when you have atrial fibrillation, everything's about 15 to 20% harder, because that fibrillating atria, you lose about 15 to 20% of your heart's ability to push up that oxygen-rich blood. You can't push out as much oxygen-rich blood, it's harder to do stuff, you're more shorter breath. So things are about 15 to 20% harder. But that's not to say things are impossible. They're just harder. So if you're somebody who has atrial fibrillation only occasionally, what I would encourage you to do is keep doing your regular activities. It's just when you have atrial fibrillation, do them about 15 to 20% slower. And that should offset the loss that you get from the atrial fibrillation, and it should balance it. Okay? I'm not a big fan of people saying, well, I have atrial fibrillation, I'm going to do nothing. Atrial fibrillation does have some consequences in terms of what you can do. Lowers your heart's ability to push the blood, makes you a little bit more tired. But then if you do nothing on top of it, you're going to decondition and get yourself in miserable shape on top of the atrial fibrillation heart problem. I'm not a big fan of that. So even with atrial fibrillation, you should be looking to exercise. Just do it a little bit slower. Okay? So hopefully that answers the question that we had about atrial fibrillation. All right, we've done our cool down. I'd like to do 2 more resistance training exercises. I can't remember what we did last week. I think one of them was squats. I'm a big fan of doing leg exercises. The legs are the biggest muscles in the body. They help with balance, getting up off the toilet, all that stuff, hugely important. So let's do another leg exercise. We're going to do a lunge exercise. So for this, my balance, once again, it's not very great. So I need to find something to hold on to, big and solid. So I'm going to hold on to my fridge. What I'm going to do is I'm just going to step one leg forwards. And then all I'm going to do is I'm just going to lunge down over that leg. I'm going to try and keep my knee over top of my toe. My knee starts going out to the left or the right or way too far forward, I'm going to hurt my knee. I don't like to hurt my knee. So we're just going to do this 10 times. Normal crystal counts for me, so I think that's 8, 9, one more, 10. Whew. I should feel that in the thigh of the leg that's in the front. Okay, now I'm going to do my other leg. I'm going to change my body position so you guys at home can see that. I'm just going to hold on to the sink here. And I'm going to do my other leg forward. Same thing, 10 repetitions. Three, 4, 5, 7, 8, 9, 10. Whew. All right, so that was my leg exercises. And the last one I'm going to do is just going to be for the back of my arms. I'm going to get a chair. I've got a chair with arms. Hopefully you can find a chair with some arms. And what you're going to do is just scoot your bum a little bit close to the edge. Lift yourself up. And you're just going to lower your bum up and down like this. We'll do 10 repetitions. 3, 4, 5, 6, 7, 8, 9, 10. All right, so there are 10 exercises for our triceps, the back of the arms. And let's just finish off with some stretching. We'll start off with a stretch for the back of the arm. Same exercise, same muscle group as we just did. So arm out in front of your body and then pull it across your chest. And our stretches are meant to go for about 15 or 20 seconds. And then let's do the other arm, so out in front, and then pull it across your body. Taking some nice deep breaths. Okay, that's good. Next stretch is for our chest. So put your hands here behind your back. If you can grab your fingers, that's great. If not, just hold them like this. And then pull your shoulders back. Look up a little bit to the sky. And that'll give us a stretch through our chest. Breathing comfortably. "15 seconds. I think that was 15. Next stretch is going to be for our lower legs in the back, the calf muscles, just pushing up against a counter, your fridge, something that's not going to move. A lot of people will call this the runner stretch. Both feet flat on the ground, and both feet pointing forwards. And then let's switch legs. Excellent. And one more stretch. And if, by the way, if you're one of the millions of people out there with bad backs, this is probably a stretch you should really be focusing on. A lot of people have got tight leg muscles in the back, contributes to back problems. Sitting down on a chair comfortably, one leg straight out in front of you, and then just reaching forward as close to your toe as you can get, just until you feel a pull in the back of your leg. Don't forget to breathe. Okay, and then let's switch to the other leg. Remember that breathing thing. We like to breathe. All right. So we can just kind of shake that off a little bit. I will come closer to the screen. Real quick before I sign off, I see 2 on my Q&A. I was wondering if this session of exercise could be performed before noon. We'll give that some thought, but right now in terms of staffing and stuff like that, 1 o'clock actually works the best for me, unfortunately. And then the other question is, does using a commercial peddler like the Cubits, I think, the Cuboy, provide benefit? Absolutely it does. Once again, that uses the large muscles in the legs. And that's always a good thing. Increases the demand for oxygen-rich blood, and that's going to contribute to improved metabolism and improved fitness, which is what we're all about. All right, folks, I think that's going to end our session for today. It's 1:35. Thank you for joining in. If you get motivated, hopefully you'll go and do another session tomorrow. I'll be back on Thursday. I'm going to leave this, I'm signing off, but this screen will stay open for a little while. If people have any questions or anything you'd like me to talk about, please make sure you put it in the Q&A. We'll collate those questions and I'll try and address them as best I can on Thursday at 1 o'clock. All right. I know Krista will want me just to share what we have coming up tomorrow. Tomorrow's sessions, culturally sensitive nutrition advice by our two wonderful dietitians, Fatima Ajwani and Veronica Rouse. So hopefully you can tune in for that. Once again, it's at 1 o'clock. And if you have any questions, please put them into the chat, and I'll do my best to answer them on Thursday. All right, folks, thank you very much. Take care of yourselves, and I'll look forward to seeing you again in a couple of days. Thanks, everybody.